Next is the oral care. Oral care involves brushing, flossing, and inspecting the patient's mouth. It's done to remove soft, plaque deposits on calculus, clean and massage germs, reduce mouth odor, help prevent infections, and enhance food taste, aiding appetite and nutrition. The purpose is decreases microorganisms in mouth and on teeth or dentures, decreases cavities and mouth disease, decreases buildup of food residue on teeth or dentures, improves appetite and taste of food, facilitates comfort, stimulates circulation to oral tissues, tongue, and gums, improves appearance and self-esteem. The equipments are soft toothbrush, toothpaste, toothpicks or swabs, emesis basin, non-sterile gloves, towel or linen saver and washcloth, cup of warm water, mouthwash, denture cream, denture cup, denture cleanser, dental floss, suction and catheter if client is unconscious. Next is the procedure, which is the assessment. Client's desire and need for oral care to determine the patient's need. Client usual routine for oral hygiene to know if the patient is equipped and to operate toothbrush. Client knowledge of purpose and procedure. Client's ability to understand and follow the instruction, to gain cooperation and to have a knowledge. Presence of dentures. Status of palate, floor of mouth, throat, cheeks, tongue, gums, and teeth to identify if there is a problem. Next is the planning. Determine the need for assistance to know how to have the preparation of the client's need. Gather all the equipments needed to lessen time. And next is the implementation. Next is to wash hands and organize equipment. Provide explanation of procedure to client. Lower side rail and supine at an angle greater than 45 degree if not contraindicated or side lying. Prone with the head turned to side. Don gloves. Drape towel on client's neck and assist client to rinse mouth with water. Assess client in brushing teeth. Provide glass of water, toothbrush, and toothpaste. Moisten toothbrush with water. Apply toothpaste to brush. Allow client to brush teeth if able. Client is unable to perform own care. Prepare toothbrush. Apply brush to back teeth and brush inside top and outside of teeth. Repeat the steps. Brushing teeth on opposite side of mouth. Allow client to expirate or sanction excess secretion. Instruct client to clench teeth together or grabs them and disable and press lower teeth to upper teeth. Brush outside of front teeth and side back teeth. Open mouth and brush top and inside of teeth. Rinse toothbrush and brush tongue. Rinse toothbrush and brush teeth again. If use of dental floss is desired, provide care. Assist client in cleansing oral cavity. Provide mouthwash soaked teeth. Encourage client to swab inner cheeks, lips, tongue, and gums or perform this action for client if needed. Instruct client to rinse with mouthwash and expectorate or irrigate mouth with mouthwash. And sanction excess fluid, then rinse with water. Have client expectorate or sanction excess. If working with an unconscious client, don gloves, brush teeth with toothbrush and toothpaste, irrigate mouth with small amounts of water, sanctioning constantly, swab mouth with teeth, moisten with mouthwash, beginning with inside of cheeks and lips, proceed to swab tongue and gums, rinse, sanction excess toothpaste, mouthwash and secretion, wipe lips with wet washcloth, apply petroleum jelly or mineral oil to lips, discard gloves and soiled materials, restore supplies in proper place, position client for comfort with call button within reach. Next is for clients with dentures. Wash hands and organize supplies. Explain procedure to client and encourage participation if able. Don gloves. Assist client with denture removal. Half-fill denture cup with cool water. Put denture cleanser into water per instruction. Instruct client to hold water in mouth and float dentures loose. Next is allow client to remove dentures or gently rock dentures back and forth until free from gums. Lift bottom dentures up to remove. Pull top dentures down. Place dentures in cup to soak. Assess client with cleansing of oral cavity. Provide mouthwash soaked to teeth. Encourage client to swab inner cheeks, lips, tongue, and gums. Instruct client to swirl mouthwash in mouth and expectorate. Follow with water as desired. Cleanse dentures. Use some procedure as when brushing teeth but may use denture cleaner. Thoroughly rinse paste from dentures with cool water. Reinsert dentures. Apply denture cream to gum side of denture plate. Insert upper plate and press firmly to gums. Repeat with lower plate. Instruct client to swirl mouthwash in mouth. Expectorate and rinse with water. Apply petroleum jelly or mineral oil to client lips. Remove towel from client's chest. Discard gloves and soiled materials. Position client for comfort with side raise and call button within reach. Place personal hygiene items in client's drawer or bedside table. Next is the evaluation. Check for intactness of mucous membrane and lips. Oral passage and teeth or dentures are clean to prevent the decay. The last is the documentation. Record date and time of mouth care. Amount of care done by client. Client's response to activity. Note unusual condition of oral cavity and lips such as bleeding, edema, mouth odor, excessive secretion or plaque in the tongue to have a legal purpose or documentation and data gathered. Next is the perineal care. So what is perineal care? Perineal care or genital care, it means cleaning and washing the external structure of the pelvic area and genital area. The purpose is to cleanse perineum, to prevent infection, to provide comfort, to teach self-care and genital hygiene. The equipments are flushing tray, receptacle for solid cotton buds for kidney basin, flushing can for soap, washcloth or bedpan, warm water. Next is the procedure, which is the assessment. Assess the client's perineal area and extent of soiling. Determine the clients. To know your clients and to determine if there's a problem with the client. Next is the planning. Wash hands to avoid cross-contamination. Assemble the equipment to lessen time and effort. Next is the implementation. Identify the client and explain the procedure. Provide for privacy. Place the client in dorsal recumbent position. Place a rubber sheet under the client's buttocks and place client in bedpan. Post perineal and drape. For female, diamond drape, wash hands and put gloves on. Female patient, flush the perineal area with warm water. Place cotton balls in a receptacle or basin with soap suds. Cleanse the vulva from the anterior portion towards the anus, then discard cotton balls. Gently separate the labia with gloves, fingers, and clean between the labia majora and labia minora. With labia separated, clean the clitoris, urethral, meatus, and vaginal orifices. Clean the thigh using stroke away from perineum and rinse and pat dry. For male patient, place pat blanket down to the mid-thigh. Move the cotton balls from the tip of the penis down its length toward the pubic area. Hold the shaft of penis and if uncircumcised, retract the foreskin, then pull back after. Use circular motion to clean the meatus and the glans penis in an outward direction. Cleanse and rinse scrotum. Turn the patient on his or her side. Wash and rinse the anal area. Replace bath blanket with top sheet or linen. Clean all the equipment and put them in a proper place. Remove and discard gloves. And after that, wash hands. Next is the evaluation. Evaluates clients for feelings of comfort. Evaluate for unusual observation on the perineal genital area to know if the client is satisfied and feel comfortable and to know if there's a problem. The last is the documentation. Record the procedure and pertinent observation like redness, swelling on the area to have a legal purpose, documentation, and to gather information. And that's all. Thank you.